But I'd like to introduce Jennifer Gatsey-Mallet. She's been working on issues on women and HIV since 2003. Living openly with HIV for the last 17 years, Jennifer is an active member of ICW and a founder and director of the Namibia Women's Health Network, the first network of women living with HIV in the country. As a rights advocate, Jennifer and the NWHN have been advocating for and leading in national and regional processes calling for ending all forms of discrimination and violence against women living with HIV, including the coercive sterilization of women living with HIV in Namibia and the region. Jennifer, thank you.
Thank you. Good morning, ladies and gentlemen. Just a point of correction. I'm now living with HIV 24 years. 17, I think that was an error even yesterday. So, my presentation today will be looking at Namibia model on achieving what worked towards scaling up to testing and treatment. I think it's also a time as civil society that we also acknowledge what is working within the country. So this is what I will be doing. The Namibian government model has been based in creating partnerships and meaningful involvement of communities, including women living with HIV, as a way of ensuring shared implementation which complements government national efforts. We are at a critical time where scaling up what already works at the community level to encourage testing and treatment is essential. In order to do this, community-level organizations and NGOs must be informed about what has worked in other communities with the aim of influencing, learning, and promoting community ownership in adopting same methods. This process of replication of models on community service delivery and advocacy is crucial in the global response to HIV and AIDS. This is the key element of scaling up community responses to HIV testing and treatment that I would like to focus on today. One must alter the system to alter the results, and Namibia's response at policy and community levels can be replicated. Policy cannot be implemented without action and advocacy at the community level to get all people living with HIV access to treatment and to make testing widespread and available to all. It must be strategic and comprehensive at the community level, or policy will never trickle down. When replicating and scaling up what works, we all must work together to implement policy. Community mobilization is the process of engaging communities to identify community priorities, resources, needs, and solutions. The reason why Namibia is considered a successful case is because of its response that included strategic national planning and policy, as well as community mobilization and inclusion of communities in policy formation. The estimated adult prevalence rate in Namibia is 13%. In 2009, USAID and Namibia pledged over $2 million to support palliative care programs, to ensure all people access ARVs, and to integrate this into home-based care programs. According to 2010 data from UNAIDS, 6,663 AIDS deaths occurred per annum during this period. People living with HIV/AIDS ultimately develop chronic or progressive life-limiting illnesses for which culturally appropriate holistic palliative care, including effective pain management, is needed. The ARV rollout in Namibia has drastically improved the health of people living with HIV and their access to treatment and prophylaxis in state hospitals. The rollout of ARVs would not have been successful without the efforts from the community advocacy and mobilization, and has proved that it is essential in bringing the resources to the people and communities. In replication of scaling up treatment, policy must integrate community leaders, women living with HIV, and key affected groups. Now that we have explored the policy side of Namibia's response to the HIV epidemic, we must look at community advocacy and where the heart of policy is the pulse of community action. Community and home-based care providers educate on condom use and HIV prevention methods, testing and treatment, care for orphans and vulnerable children through community support groups, individual support and care. These groups also emphasize adherence to ART. Total epidemic control patient experts are women living with HIV who are trained by the Ministry of Health and provided with a 1,000 Namibian dollar stipend a month to educate people living with HIV in the community about testing and treatment services and issues surrounding stigma. Without the community and the home-based care experts as well as the patient experts, the successful implementation of the ARV rollout would have been compromised. The hospitals supplied the ARVs, but community actors mobilized people to access the treatment. Successful implementation must come from both the top and ground level. Adapting and implementing WHO guidelines, Namibia experienced a 50% decline in MTCT, that is mother-to-child transmission, between 2009 and 2012, and is considered a high-performance country based on these results. Prevention of mother-to-child transmitted was implemented in 2002 and achieved 77% coverage of pregnant women by 2010. In 2012, the government of Namibia piloted the elimination of mother-to-child transmission program to address the need to focus on the mother as well as the baby and to include women who are unsure of their status. Its goal is to have no babies born HIV positive by 2015 and keeping the mothers alive. The Namibia Women's Health Network and the International Community of Women Living with HIV, they are implementing a program called Mother Circle. It's an EMTCT program which encourages women and new mothers living with HIV to adhere to treatment through nutritional programs. Community support for programs like EMTC is essential components in Namibia's successful scale-up of access to testing and treatment. The 2010-2015 National Strategic Framework in Namibia is a comprehensive plan to scale up testing across the nation and improve the quality of life of individuals living with HIV through community-based care, support and access to comprehensive treatment and ARVs. In 2013, awareness-raising inputs and HIV tests at the workplace were made available to 45,000 company employees. The workplace is a significant source of resource sharing and cannot be overlooked in Namibia's community response. What has been the impacts? The model of Namibia impacted and strengthened collaboration and partnerships between government, civil society, and communities. And it also endorses the importance of creating smart partnerships with communities. It also creates policies which respond to community needs and ensures national budgets are tailored to support communities and civil society programs in scaling up access to testing, treatment, and support. It promotes meaningful involvement of women living with HIV, key affected groups, and communities in all stages of development, developing policy, promoting and scaling up access to testing and treatment. It also puts women and living with HIV and key populations at the forefront of policy development. All this was made possible by funding from Global Fund and PEPFAR. Hence, we urge Global Fund to be resilient and keep on funding post-2015. We have achieved so much, but there's still a lot to reach to reach an AIDS-free world. Stigma and discrimination at public health centers for people living with HIV is still very high. And there's a need for more health workers in Namibia because we've got a shortage of health workers. And there's also a need to elevate from high middle income status which Namibia has been given And they still need support because there's still a lot of work. We are now starting to face stockouts. Namibia didn't meet the Abuja Declaration of 15% health. So to end, I'll end with what our president said. We also need, I quote, we also need to care with empathy and dignity for those who are living with HIV, their families and communities. We need to remember that although individually we are like grains of sand, together we are the majestic dunes of Namibia. We can be powerful and majestic together. That this is true for Namibia's response to the HIV epidemic. I thank you for your time in listening to my presentation.
Thank you very much, Jennifer, for that wonderful presentation.